Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Hi folks, this is Dr. Virender Sodhi, and I'm here again today with your favorite show, Your Body is a Natural Medicine. Your body makes every medicine on demand. And today's topic is very interesting. We are going to talk about bedside medicine. What that means, that how the doctor delivers the message of a disease has a very particular effect on his progress and the disease. And it is unfortunate that in the high-tech medicine, the bedside medicine is losing. Doctors are not very compassionate. It is also because of many reasons, and one of them is insurance guided stuff. A lot of HMOs and doctors are given very short period of time to complete the diagnosis and write all the paperwork. You know, being a physician myself, I know that I have a constraint on my timing, which I can spend. Although being a naturopathic physician, we spend a lot more time than the usual medical MDs in their office. So in my office, we average patient, the first office call is usually 45 minutes and the follow-up calls are 30 minutes. And we try to justify, although we don't get paid for according to the time we spend with our patient. And usually, you know, even the smallest appointment is 15 to 25 minutes. So the bedside medicine is a very important way of delivering to the patient, and that helps the high quality care. When patient comes to a doctor, they are often very fearful and anxious, and the doctor's job is to calm their fears and offer them a hope. The way the physician behaves, the mannerism, is a very important element for the patient care. Ayurvedic traditions for thousands of years have addressed that the compassionate physician is very important to help the healing process of the sick person. So Charak, who is the father of medicine in Ayurvedic medicine, wrote several thousand years ago, is approximately 5,000 years ago, or maybe more than that. A physician, even well-versed in the knowledge of disease and their treatment, does not try to enter into the heart of the patient by virtue of the light of their knowledge. They will not be able to properly heal the disease. So this is what Charak, the famous physician of Ayurvedic traditions, said, that you have to have a wonderful knowledge and you get into patient's mind and you help them to heal. A good Ayurvedic physician will always pay attention to the physical appearance, body language, demeanor, observation skills, and above all, the communication. How you convey a disease, especially a fatal disease or serious disease, is very, very important. And I try to listen to my patient very carefully. Maybe I'm not perfect, but I try to at least listen to it. And the listening is very important part of the a healing mechanism. And when you listen to somebody, we have so many patient who has come and said, okay, the doctor walked in, neurologist walked into the room and told the patient, I'm sorry, you have Lou Gehrig's disease. And then few minutes later, he walked away from that patient without telling him what is going to happen now. And when he goes home and he start Googling on the internet and Lou Gehrig disease, and it's a very wasting kind of disease where the body loses control, nervous system get weaker, muscle get weaker. And he is experiencing a lot of anxiety about that. Similarly, somebody walks into the room and the physician walks into the room and says, okay, unfortunately, Mr. X or Mrs. X, you have HIV positive, AIDS. All of a sudden, the whole world of that patient changes. Similarly, the cancer patient, a lot of time, what we do, we tell them you have this kind of cancer, and then we start discussing the statistics on the cancer. If you have this kind of stage, your chances of living is this. If you get this treatment, your chances of living is this. And the patient is completely blown away with this whole information. And that really makes a bad negative impact on the patient. So my effort is today to tell that what should be done and what patients should do. And I'm going to talk about some studies which have been published on different diseases. And there was a very interesting article published in the Oncologist, which says that 7 things that doctors should not say to the patient. So it's really interesting. 7 things oncologists should never say to the patient was published in the 2014. So I'm going to discuss that one too, and how what oncologist says to a patient and what impacts it can have on the patient is very, very important. So before we go for that, a good doctor will sit calmly. He will be very neither attached, neither detached, just in the center, like a Zen and like a yogi. He is, because the problem with the attached or detached is if you are not in the center, you are going to create your own aura around it, and that will impact negatively your patient. So first of all, you should nicely greet the patient, and when he comes in, walks into the room, and make eye contact with the patient. Give a proper introduction to the patient, what you are, who you are, and use very honest body language. Don't try to pretend. And many times, patient has come to me and said they have this and this disease, and truthfully, I did not know that disease name even. I have not seen a patient, because there are so many diseases out there, and although I've been practiced for 37 years, there are still many diseases which I don't know, and which mean I don't know. And so I tell honestly my patients, say, hey, I don't know about this disease, but let's discuss, let's not look at the disease only right now. Let's look at the whole history of you. And then also I will go and read on this disease, see if I can be of any help to you. So again, listening to the patient carefully is very, very important, and with undivided attention. Coming back to this article, which was published in the Oncologist, 7 things which oncologists should never say to their patient. And one of them, that the first and foremost thing is, the doctor should never say, I have a bad news for you. The language bad news is not the best way of conveying anybody with a diagnosis which has a fatal consequences. And most of the time, whenever people has a cancer, the word CA has a lot of negative impact on people. And so most of the time, we should say, okay, you have this and this, and according to the results, this means that you may be having this disease, and we can help you to sort out what kind of treatment strategy we need to make, and we may need to collect a team of doctors to help you. So there is a way of saying things which makes patient more comfortable. I don't, like the ideas of conveying a bad news, because when we say that bad news word, the patient who is already fearful, is already anxious, is going to take that in a very bad manner. Even conveying in normally the diagnosis of cancer is very traumatic to the patient, and a patient can go into like a fits with it. It can be a very, emotionally, psychologically, and spiritually very depressing to the patient. And one thing interestingly, if we have to diagnose a cancer, and I believe that all of us have cancer, it body is very intelligent, and it can see what kind of cancer cells you're making, and it can destroy it. So practically speaking, we all are suffering with some kind of bad cells in our body. These bad cells are not behaving according to the normal homeostasis law, normal body physiology laws, and so those are the cancer cells. And cancer is not a single disease, it's a combination of many diseases. When people get cancer, there's lots of things going abnormally wrong, and one of the impact is mentally and emotional. There's a huge concept of stress and the cancer. Then doctors should not ask that why didn't come when the first symptoms came in. So it makes people feel guilty. When your doctor says that, they says, oh my God, I've done a big blunder, and I am going to be in bad shape, right? So just to put out there, majority of the cancer, except for a few, are slow growing. They are not growing very fast, especially like breast cancer type of stuff. They grow slowly. But when people get a diagnosis, they think, oh my God, this is the end of it, and I'm going to die very quickly. But that's not true. Just to compare that, almost every man out there above age 70%, 70% of them has prostate cancer. But that does not mean that kills them. So they can still have a normal lifespan up to 120, even 130, and prostate cancer may never kill them, because body is intelligent, and it says, okay, you are a bad cell in my body, and I'm going to circle you with a capsule so you don't go beyond that limit. And so whenever we say that, you should have come to me when you have first symptoms appeared in you, that makes patient feel very, very guilty. And we don't want to create that guilt sensation in a patient. The third thing, which oncologists should never say, that you are wasting your money on supplements. This has been a huge, thing for naturopathic physicians, especially, and my colleagues. A lot of us were 20 years ago, 10 years ago. If you have been in the business like me, I've been practicing for 37 years, and I have been here in Seattle area for the last 31 years. And I've seen it all. A lot of these medically trained doctors used to think that what we do is all quackery. But over the time, with the science and the publication of more data, it came out that this is what we do is a science-based. It's not a voodoo-based science. It's a real science. And so according to the survey, almost 90% of patients with cancer use some kind of supplement. And so one thing is, if the supplements are not interfering with the treatment they're getting, and they are feeling better. There may be some placebo effect. We will talk about placebo effect in a few minutes here too. But it is going to help them if the patient thinks it is going to help them. And a lot of vitamins, especially vitamin D, is needed in cancer patients. Most of the cancer patient has a low vitamin D. And so, that's phenomenally good. Vitamin C, again, another very commonly used. We use very heavy doses of intravenous vitamin C. You cannot take heavy doses of vitamin C orally, because when you take it, you're going to just have a loose diarrhea and you're going to lose it. And my colleagues has written articles on it, which has been published in mainstream medical journals, that most of these supplement does not cause interference with the radiation or chemotherapy. There is some vitro study which has been published, but when you see the overall impact of it, it says, oh no, this is not happening because the patients are getting better. For example, the turmeric or curcumin almost has shown positive results with almost any chemotherapy and radiation treatment. If anything, it actually enhances the effect of, in many cases. There are some contraindications, but majority of the time, they helps it. So when a oncologist say that, you should not take, you're wasting your money, and I have heard that from my patient, that my oncologist said that you're wasting your money, whereas the data proves it otherwise. There has been a lot of published data available now, and people are intelligent. They Google, they go on internet, and then of course all the information on internet is not right either. But if you go to a good medical site like PubMed or Medline search, you will be able to find nice articles written by in peer-reviewed journals where the information is correct. And then, another thing which physicians should not tell their cancer patient, that don't leave this vicinity, because when you're telling them that don't leave the city, they are feeling, oh my God, this is my end. I am going to die very soon, and that's why my doctor is saying that. And even with the patients who are getting chemotherapy and radiation, of course, there is a chance of getting them, because the immune system is weak, they can get some infection. But with the proper precautions, with the mask and stuff, they can travel and they should be okay. And especially if there is a functions in the family, they have a marriages or they have some special occasions, because when you go to these kind of occasion, your mindset changes. You feel more positive, you feel more happy, you see your relatives or you see your friends and your family, you feel more positive. So that should be also not there. You should not tell, okay, don't leave the city, because that will send a really bad fear in a patient. That the another thing which the doctor should not tell, that he should have never smoked, because he knew the smoking is a problem. A lot of people smoke out there, and I have lots of patients, and every visit they come to my office, and I tell them, please work on your smoking. What kind of tools I can help you with? You can go for acupuncture, you can do hypnosis, you can do detox, you can take a nicotine patch. There are lots of options available. But if your mindset is not ready to do that, most of the people just wait until they get a big warning. But once they had that kind of bad warning there, we should not try to make them feel guilty again, because that will create a negative impact again. So another thing which really gets me is many times when oncologists tell their patient is, Mr. or Mrs. So-and-so, I have a bad news, and according to what kind of cancer you have this many months to live. And what we are doing, we are actually playing the role of God here. And nobody knows when somebody's going to die. So this is for sure. Because if that is true, then we all have a date and time, exact date and time when we're going to die. But it's not true. So, but when we give this message to the patient, he is going to follow the doctor's order to the last point. And this has happened with my dad. He was diagnosed with the lung cancer. And once he got diagnosed with the lung cancer, we were trying to keep it, we didn't tell him that he has a lung cancer. But one day his doctor told him that he has lung cancer and he's going to live not more than 1 month. And guess what happened to him? He did not pass a month. He died exactly on the 30th day when the doctor told him. So a lot of time we are creating a nocebo effect, a bad impact on the patient, and that will kill him. There is interesting studies available out of China. In the Chinese New Year, the elderly people are given a lot of gifts, and or the families get together, and they meet their grandkids and great grandkids. And what they found out that during those months, the deaths reduce drastically. So looking for that moment, looking for that creativity moment, the people even suspend the death. And as soon as the New Year's passes after 1 month, their death rate is again similarly. So it's interesting that, the human mind is a very powerful medicine, and we should use it positively rather than negatively. Then again, the doctor should never tell his patient that this treatment will not make them sick. Most of the chemotherapy radiation, I hear it all the time. Oh no, you're going to have some problem. You may lose some hair, but it is a very bad way of saying to people. You can say yes, you can have some side effects, and these are the side effects. But if the treatment is fine, you will be. So we should tell the patient the truth, because if we don't tell that there's a side effects to chemo, and everybody knows there is a huge side effects of the chemo and radiation. If you look at a lot of times when people has a lymph node positive, they're given radiation treatment, and the overall survival with the radiation treatment is less than 5% increased than the people who did not do it. And so you can see for 5%, but also they can have other diseases, like they can have lung fibrosis. So now they may be suffering with the COPD, or they may have a heart disease because the heart got scarred. So they may die prematurely. So I think if you have to look at the overall picture, we need to convey that message rightly. So we'll be continue our discussion after a short break here, and we'll still continue that how the cancer patient should be addressed, and what they should be told by their doctors, and some of the interesting studies which been linked to it, and also the placebo effect of the medicine and the nocebo effect of the medicine.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So we are talking about what oncologists should not say to their cancer patient. And so one of the things is, they should be ready for all the questions, and also patients should ask a lot of difficult questions too. I think one of the questions which is get muffled in is the how many treatments they go, what is the improvement in their overall improvement. So there is a like an absolute risk reduction or a relative risk reduction. So relative risk reduction is different than absolute risk reduction. But what we're looking at is the absolute risk reduction rather than the relative risk reduction. So that is most of the time when people get information, it is not very clearly given to the patient. And so I think, be ready to ask hard questions from a doctor too. And it is a difficult situation whenever somebody get diagnosed with cancer. So the placebo is a very powerful medicine. When a doctor instills a confidence in a patient's mind, that patient is going to do much better. There's the studies after studies shows that when patient is confident, doctor is confident, the outcome is much more better, much more pleasant then if the doctor is not confident and patient is does not cannot be confident, if the doctor is not confident, they have a bad outcome. So mind influences the physiology of your body, and which that effect is called placebo effect. uh, Placebo means pleasing the body. So what, like every emotion we have has a negative or a positive impact. For example, if you're anxious, you are fearful, are you going to trigger a epinephrine response in your body? And epinephrine response is important for us, but it should be for short term. But when people get stuck in that mode of high cortisols or epinephrine, their immune system is completely working differently, and it weakens the immune system, and the body does not have a chance to heal. Similarly, the anger, frustration, irritability also has negative impact on the body. Now, with the science of epigenetics, we are finding out that a lot of these emotions on our body can have negatively impact us. So to generate a placebo effect, I think doctor has to go inside the mind of a patient and try to create a appropriate team for them. Uh, it can be a meditation, yoga, can be a psychologist, psychotherapist, the family therapy, looking at the all the aspects of it and create that positive impact for him, so which can create a very healthy atmosphere for him to heal. Uh, the placebo effect has been studied a lot, and there has been lots of papers published on it, and I like to go on that one because there is a science branch of science called psychoimmunology. uh, what that means is what the mind saying to the body and how the body is reacting to it. We all have experienced nightmares once in our lifetime or sometime more. Uh, and when you are in that nightmare, you are thinking it is so real, it's exactly happening to you. And I can relate with my nightmare, which has happened not for many years, but it has happened. And I was sweating, my heart was pumping at the full rate, and I was shivering in the middle of night. And it was a nightmare. It was not a reality. But my physiological body reacted to that nightmare that if it was happening really to you. So that is the example. You can see that how our body is controlled by our psyche. It's very important to understand the effect of placebo in patients, and we should try to create that positive atmosphere around a patient so that they can really make a good use of it. Mind is a powerful healer, is an unbelievable healer. uh, I going to share with you a story of a Indian athlete girl who was raped in a train and then was thrown out of the train into the tracks, and somehow she fell in between the tracks. There was two opposite tracks going in that, but she fell in between, and she had shattered bones. Her legs were shattered, had so many bodily injuries, and it was in the middle of night, and she laid there until in the morning, when the villagers came out and saw the body of this lady who was unconscious, and they rushed her to the nearest hospital. And once they put her together, she survived, but she lost one leg completely, and because it was so badly shattered, she got the prosthesis fitted on. And when she was in the hospital, she said she is going to change the way her disability is going to affect her. And she decided that she is going to climb Mount Everest. As you know, Mount Everest is the highest mountain in the world, and several thousands people try every year to go on Mount Everest. I think now there is a quota, and it's very expensive to climb it too. And many people has died climbing. Many people has died while climbing Mount Everest. And even if people with two legs, with normal, no body injuries, has difficulty climbing, but this girl who has a prosthesis has decided to climb Mount Everest, and she goes to the mountaineering school and tell that she wants to be a climb Mount Everest, and the manager just looks at her and says, "Oh my God, if you have made that decision without a leg, I will do anything which I can do to help you." See, look at the positive effect of that manager there. What I can do within my limit, within my force, to help you to achieve that goal. And this girl start training, and she, because she has the prosthesis, and she will be bleeding because the prosthesis will not fit, very properly, and rub. But she did not give up, and she has climbed Mount Everest many times. Not only Mount Everest, she has climbed many mountains around the world. So you can see that there is a desire, there is a will, which has a placebo effect on. If you want to change it, you can change it. And similarly, there is a book written by Anita Moorjani. Anita Moorjani, the author of the book, had a metastatic cancer, and she was hospitalized with the last stage of cancer and was almost ready to die. And when she was in that dying mood, she had a vision. In that vision, her father came into his dream and told him that why she's so fearful. And she realized that the fear was the cause of her cancer. And she had a difficult upbringing because she was a Indian origin, growing up in a foreign country, a lot of difficulties because of the different cultures and the norms. Once she realized that the fear is the cause of that disease, she let her fear go, and guess what happened? She recovered from that cancer, the end stage of cancer. And there is a book which I highly recommend you to read, and it's called "Dying to Be Me." The book again is "Dying to Be Me" by Anita Moorjani, Moorjani. So, it's a good read. I think everybody should read this book, not even if you don't have a cancer, because this tells you that what the power of mind is there. There is also another book written, if I'm now blanking on the author, but the book name is Radical Remissions. This is a scientist, psychologist, PhD psychologist, who has studied patients who has gone into remissions with the terminal cancers. And so, if you go and in medical literature and you try to read through it, you will see there are cases after cases been documented with cancer, with the rheumatoid arthritis, with ulcerative colitis, with Crohn's disease, with the heart diseases, autoimmune diseases, which are considered chronic diseases and should not, you should not be get rid of those diseases. People has gone into remissions, and interestingly, the methodology most of have that followed is very similar. One thing, they changed their mind. They went into meditation. They created a good circle around them, circle of health, circle of hope, and good sport. They changed their diet. They have used alternative medicines like acupuncture, Chinese medicine, Ayurvedic medicine, naturopathic medicine, homeopathy. And this girl has actually created a website, Radical Remissions, and people are documenting that who has gone into remission with even terminal cancers. And I'm actually also, because I see a lot of cancer patients in my clinic here, and I'm trying to create a website of my own where people who has cancers and has gone into remission and have not done standard medical care, because I want to see if this apples to apples is true. Like if you do treatment the natural way and you're doing a standard care, what are the difference? And are we doing something wrong? What we are doing is wrong, or what we're doing is valid. And once it is valid, and we can have some scores there, or we can see apples to apples that my God, this treatment is. And so far, I'm very happy to report to you that most of the patient which we see, unless they are in end stage already and they come to me, they have gone into remissions or people live longer. So I think there is a huge work of the placebo effect on it. We are our own placebo. If we want to create a disease, if we can create a disease, we can also destroy it. But most of us, we don't get that we are so fearful, we are so anxious that the fear, anxiety, anger, frustration, or attachment just does not allow that healing process to kick in us. And it has been known that body heals. Like even when surgeon cuts something, you see that body develops immediately within a few seconds of removing that stuff. The body start to develop its own network again, start healing that process immediately. We all have that experience in our life. When we fell down, we have scrapes or cuts, and you see that those scrapes and cuts start to heal even if you don't go to doctor within 7 to 10 days. Then they all healed. You don't have to even take a medicine. You just take good care of it, and the body responds very well. Even people with fatal infections has cured themselves with the healing mechanism of the body. There is a lots of information available online these days, and you can certainly go and check that out. So the placebo effect is so important that even people who had gone under surgeries, and when a prayer was done for them, they had a remarkable recoveries. And this has been studied again in double-blind control fashion, which is the standard medical studies. The clinical studies are done, and what they found out that they were 5 times less likely to be on antibiotic. 5 times. Whenever you go under surgery, the antibiotic is a standard protocol. So they did not need antibiotic, and there was 5 times less. 3 times less likely to have pulmonary edema. When you are sick, you're on the bed, the lungs get pumped up with the fluid, and they cannot get the fluid out. And so 3 times less. Again, you can say, wow, this is a placebo. 12 times less likely to require endotracheal intubation. So, when the people are going for these surgeries, they have to have these tubes put in there for anesthesia. But after some time, to keep them on a respirator, they have to put that tube in there. And there was a 12 times less requirement for that. So that means they did not go into respiratory distress or failure. So you can see there is a huge, interesting studies being published already on this placebo effect. So the placebo effect is for real. It's not unreal. But what maintains the placebo effect is, one is the doctor's positiveness. If the doctor is positive, if the doctor is conveying the message of positiveness to the patient, he is going to instill that good placebo effect on the patient. And so if the patient understand that he is going to get better, he is going to get better. That's true, because you have sent that message to your body, get better. Just to tell you another interesting studies which has been done on cardiac patient who has bypass surgeries. When people had a thankful attitude, the people who had cardiac surgeries, they were thankful. They were thankful to the doctors, they were thankful to the family, thankful to the hospital, thankful to the nurses. And this was actually done on a daily journal. They were 50% less death in those people who were thankful. People who were angry at the doctors, were angry at the nurses, angry at the family, they have 50% more death. So just imagine being thankful to yourself, to the doctors, to the nurses, to the hospital. There was a 50% less death. If this is a medicine, if there's a pill for that, there'll be multi-trillion-dollar drug. And we can invoke that process of healing in us. But most of us, we don't, because we are so gripped with the fear, so gripped with the anger, so gripped with the attachment. And the funny part of the story is that we all are temporarily here. Nothing is permanent. Neither a disease, neither us, neither what we think around us is changing every second. And so the philosophy of Ayurvedic medicine, which actually is based on the philosophy of Gita, that we are a constant influx, and what we have to become, not attached to these things. We become a witness. You don't get attached to it. When we get attached to it, we get a disease process. In Buddhic medicine too, they said the cause of the disease is a desire. And when we have a desire, we get attached to it. But you can have a desire, nothing bad having a desire. But when we get attached to the desire, then is the problem. If you not get attached to the desire, that is perfectly okay. That becomes like a yogi. Yes, you want to create, but don't get stuck with that outcome of it. The outcome can be positive or negative. But if you did your work, if it didn't come out the way you want to come out, perfectly okay. And so you just let it go and you flow with the flow and you try it again. So this very important that, how you can create that placebo effect within your own body by following simple laws of Mother Nature. We're going to take a short break here, and then we'll keep discussing the effects of placebo on the healing mechanism of the body.
Someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
So we are talking about the placebo effect on the healing. So I want to interestingly tell you an interesting story, which was from the early 1950s. There was a drug called Krebozion. So Krebozion, Krebozion. And this drug was for lymphosarcoma, for advanced lymphosarcoma. And even in those days, they were trying to charge several thousand dollars for this drug. And it came out with a lot of pump and show that it cures cancer 100%. And the physicians were given same kind of information that this drug is so powerful, it cures cancers. And interestingly, when that message was given to the patients also were getting better. They were getting cancer free in 1 to 2 months. Even first injection will reduce the size of a tumor 50%, because the doctor instilled that power in him, and that power was transferred to the patient. But later on, when they did a double-blind control study, they found that it did not have any impact on the cancer, and that then the effect of that medicine completely wore off. So you can see the doctor can create a very powerful effect on a patient. And I'm not, one of the interesting thing is, you say, why should create that placebo effect? Why not? It's free. It does not have a side effect. If it gives you hope and it makes you feel better, why not to create that? So this is a really happened story in the drug model here. There is another studies done on the pain management, and as you know, almost everybody goes to doctor because of the pain. Pain is the one of the most reason why people seek medical advice. And the most common medications are given are analgesics drugs. And so Ivan and Beecher, they reviewed around 26 blind studies, and they found that 35% of the patient with pain experienced 50% reduction with the placebo only. So 35% patient, they have a 50% reduction in the pain with the placebo only. And even the most powerful drugs like morphine, 75% of the patient have a 50% reduction in the pain. So you see the placebo, you see the morphine, which is it knocks you out, very addictive. The results are very much similar. So if you can invoke that healing mechanism in you, you will be amazingly better, and it's all free. Mother Nature wants you to get better. The body wants you to get better. And but what you have to do, you have to follow certain laws of Mother Nature to help that process. And so what do you need to do to create that placebo effect in you? So I already talked about the mind. And if you don't want to be healthier, nobody in the world can make you healthier. Nobody. No, there is no drug for that. So keeping the positive attitude and non-attached, without anger, without frustration, without fear, without anxiety, without attachment. And if you look at, what is the source of that anger, frustration, irritability, anxiety, sometimes writing them down is very helpful. And going for a psychotherapy or counseling, sometimes because we all are used to doing certain things in a certain way, and we have lived with that behavior for our whole life, it's very hard for us to see that. Sometimes somebody else can really tell you, this is what you're doing wrong. And you needed to help that process by going for this and this and this. So if you follow those simple, process of going for a counseling, going for a family therapy, then food is a very important part of your healing mechanism. If you use the wrong gasoline in your car for one day, your car will not move. The engine get destroyed. But look at it. Most of us, unfortunately, in today's world, we have a food which has been completely altered. And we are using the food which our ancestors never used. We have so much heavy load of chemicals, pesticides, insecticides, plastics, hormones, drugs, because there's so heavy use of drugs in our population. Average person by the age of 70 is using 7 drugs, and half of them, these drugs are given to cut down the side effects of the other drugs. And so what we are doing, we are urinating those drugs into our urine, and that is getting saturated into our rivers, into our sea. And so you don't have to get a dose of Prozac. The water will get you, because the water ultimately, it seeps into the environment, and environment cannot completely clean these things because this is not natural. They are chemicals. And so we are consuming that product back again. So you can see that how much stuff is out there. For example, a female in Japan, living in rural Japan, has the chances of getting breast cancer 1 in 125, I think 125 or 120, something like that. So, which is very less, it's even less than a 1% chance. But in America, the chances of getting breast cancer is 12%. That's a 1 in 8. 1 in 8. And look at this one. If that lady who lives in Japan, moves to America, her chances of getting breast cancer becomes same 1 in 8. So there is a huge environmental impact on this disease. I've seen that back in India too. When I was practicing back in India from 1980 to 1986, I never saw a single patient of cancer, not a single one. Now, every time I goes back there, there is some friend, some relative who has been diagnosed with cancer. I get calls every day, from the patients from India, because since I'm in oncology, people are getting cancer left and right, and the chemicalization of the industry, of the farming, has added on to have too much load on the system. There is a city of Bathinda in Punjab, and it has a coal-fire thermal plant for electricity. And since the installation of that coal-powered thermal plant, the cancer has increased so much in that belt that there is a one train which starts from Bathinda and goes to city of Ganganagar, which is in Rajasthan. And that train, every passenger has cancer. Or so that train actually is named cancer train. You can well imagine, and that was not there before. That was not there before. So we have a huge environmental impact. And so the environment has to be clean. And this is on all of us. It's not one person. I can't do single-handedly. But if every one of us start changing that, I'm not going to buy a product which is chemically altered. And that also makes all the products, all the food which is available on the shelf. Look at any product. They has to have chemicals in it to preserve it. Our ancestors never ate that food. Our system cannot handle that. Simple. Even the yogurt, which you see a normal plain yogurt, it has chemicals in it. You can make yogurt at home. Don't buy that yogurt because that has chemical in it. Even organic, they put guar gum and this and that, which does not needs to be there. The real yogurt did not have those things in it. So, you need to get rid of all the packaged food. Eat fresh vegetables and fruits. Lots of different phytochemicals are present in our vegetables and in fruits. For example, you see a lot of pumpkins these days because the fall season is coming, and those yellow big pumpkins look very attractive. Mother Nature has perfected it for millions of years, and that's what the Ayurvedic medicine said: eat according to the season. And nowadays we don't know what season we are in because everything is available all year round. But if you eat more pumpkins and more squashes, which is available these days, naturally you are riching your body with special kind of bioflavonoid, and one of them is lutein. Lutein is a yellow pigment in the plants, which is very protective against cancers and especially for the eyes. So again, you can see that Mother Nature has given us that, and the pumpkin seeds. There is a huge benefits of pumpkin seed. Have you ever noticed that why we have more nuts and seeds in the fall rather than in the summer? In the summer, we have a lot more juicy fruits and vegetables because in the heat, we need that lot of fluids in us. In the summer, we need a lot of oils. Nuts and seeds has lots of oils in it. So you can see that we can create a positive impact. Going in the Mother Nature, walking naturally in the Mother Nature has an amazing effect. It boosts your immune system 40%. I've said that on my radio show many times. So go out for a walk. Even if you walk once a week, your immune system is 40% up, and this stays up for 1 week. When people were gone into jungle for 2 days, regularly stayed in jungle for 2 days, the immune system was up for 1 month and 40% up. Meditation, yoga, breathing exercise, these are all free medicines. You don't have to go to doctors. You can do all the things which you doing, what kind of care, that does not matter. But if you add these things into your treatment protocol, you'll see that your healing process is a lot more. We have done many times in our clinic here with almost all chronic diseases. When people adhere to the program, the healing is miraculous. They are feeling so much better. They have amazing healing journeys.